With us now is the CEO of the UConn Health System. He is Dr. Andy Agwunobi. And Dr. Agwunobi, thanks so much for being with us here today.
Thank you for having me.
What is the current status of the UConn Health System?
It's doing extremely well, very strong, growing fast, and has a wonderful brand. And most importantly, providing great quality care and safety for the patients. In fact, I was just saying that we have 9 consecutive A ratings for safety,
Wow.
which is almost unheard of among hospitals in the state.
Because a few years ago it wasn't doing well, and the state had to put some money in to rebuild some of the things. How did you get from that point to this point?
Yeah, well, a few years ago, the state put in quite a bit of money under Bioscience Connecticut, and there were some metrics there where we had to grow and demonstrate return on investment, and we accomplished that. Right now, we still receive about 8% of our funding, so most of our funding comes from patients, over $1 billion. But we receive some, and we consider that an investment into the medical school and the dental school predominantly. As you know, you may not know this, but we train 65% of the dentists in Connecticut and 1 out of 4 physicians. So most of that funding goes to our academic enterprise, with a little bit going to the clinical enterprise.
Back in the day when the money for UConn was being discussed, there was some discussion as to whether they actually needed a UConn Health Center and a third health system. How did you respond to that?
Well, I would say, UConn Health is very different today. UConn Health is, for example, back in the day, as you say, we had about $350 million in net patient revenues. Today, we're over $1 billion. In fact, our total budget is about $1.8 billion. So we've grown astronomically. And in fact, UConn Health is the fastest growing health system in Connecticut by far. I mean, most others are flat to mid single digits. We grew 30% in 3 years. And it's really because of, I mentioned the quality and I mentioned the safety, but it's also the patient experience. I mean, UConn Health is the highest in terms of patient experience in the state right now. People love it. They love to come here. So it's a very different organization, and I think it's proving to be valuable for the state of Connecticut.
Because there were some who say, obviously, it's too big to move now, but years ago it should have been built on the UConn campus or in Hartford. Do you agree with that?
I think, well, let me say this. I wasn't here then, but let me say this. It's in a beautiful part of the state.
Sure, I know it is.
In Farmington, and people love to come there for their care. So you can get the same type of care you get at Yale New Haven Health System, but you come to the leafy suburb of West Hartford in Farmington for that care.
How competitive is the health industry right now? Because we've seen massive expansion by Hartford Healthcare and also Yale New Haven Health.
Yeah, it's very competitive, and it's important to have scale, to have size, and that's one thing that UConn Health has in our strategic plan is to grow. Even though we're very strong as a healthcare system, we're one of the smallest healthcare systems in the country, and so our strategic plan is to grow and expand, but particularly in public-private partnerships.
So UConn Health wants to take over some existing hospitals that have had some financial difficulties. Explain this to us.
Yeah, so what this really is the state of Connecticut, through UConn Health, having this goal to essentially save community hospitals, particularly Waterbury, and to make sure that that region has healthcare access. And that goal, the state's goal, is right in line with our strategic plan and our mission. Our mission as the only public academic health system in Connecticut is to make sure that everybody in Connecticut has access to healthcare. It's not about us competing, it's not about being predatory, it's about making sure that everyone has access, even if it's not us, but other hospitals providing it. And it's also in line with our strategic plan to grow, as I said before, and to bring the quality of care that I discussed with you to everybody in Connecticut, more people in our region. So we have a sort of an alignment in terms of those goals with the state.
So if some taxpayers were to say, or some lawmakers were to say, I don't think we should fund UConn Health, what's your argument that they should?
Well, I would say that, first of all, it's not actually funding UConn Health. It's funding because this, and it's a big if, by the way, there's a lot of approvals that have to happen,
Sure.
Legislators, the governor, board of trustees, board of directors. But if this was to go forward, it's creating a private clinical network. So they would not be a public institution, they would not be state employees. UConn Health would be separate, would continue to be separate as a public entity. So the funding that we're talking about would be going for this hospital or hospitals that the state is trying to preserve access for.
You mentioned competition earlier, that you don't really compete with them, but in reality, don't you compete with Yale New Haven Health and Hartford Healthcare for patients and in terms of primary care?
So
and
look,
that sort of thing?
obviously, just by being in the market and providing great care, we're competing. But our philosophy is that we're a public institution, and what we do is we focus on the quality and the patient experience, and we let everything else take care of itself. Now, that has led to us being the fastest growing in the state, so you could say, yes, we're competing, but we're not doing it, I wouldn't say that we're doing it in a predatory or deliberate fashion. We're just focusing on what's important, and that's care for the people of Connecticut.
Dr. Andy Agwunobi, he is the CEO of UConn Health. Thanks so much for being with us on the program today.
Thank you.
The new Connecticut Pizza Trail when we come back.